Good eyesight gives us a tremendous access to the world around us. It helps with our day-to-day activities, to interact with people around us, to see their expressions, to see the outcome of our activities, and many more. So much of learning and interaction occurs visually. This is a challenge in the case of visual impaired children. Visualization of things like a normal sighted person is not possible by them. On noticing visual impairment in children, immediate appropriate measures must be taken to inhibit the delay in development of wide range of skills which are easily learned by sighted children. Visually challenged children learn these skills in a different way. The base of their learning pattern will focus on touch, sound, smell, taste, and whatever vision they have left. Visual impairment is not homogeneous, that is, it can range anywhere from total blindness to low vision. Hence, it is important to identify the underlying problem and help the individual cope up with the same. Each visually impaired child must be treated as an individual, and his developmental plan should be based on his individual needs impairment. This way, we will be able to provide timely and appropriate support, maximizing the potential of the child and help in the development of the required skills helpful for his future. Also, we should understand that this process of learning is challenging for the individual. Hence, we should take measures to focus on associated emotional and behavioral problems. This will ensure that the overall development of the individual is taken into account. In order to understand the causes and implications of visual impairment, it is important to understand the structure of the eye and its functions. The eyeball lies in the eye socket, which is closed by the eyelids. The eyes are protected by the eyelids, eyebrows, eyelashes, and surrounding connective tissue and fat. The eyelids contain oil glands that help lubricate the eye and prevent in the evaporation of tears. Tears are formed by lacrimal gland which secretes tears to moisten the surface of the eye. The tears are then drained into the lacrimal sac, also called tear duct, located in the lower eyelid. 6 extraocular muscles attached to the eyeball to the wall of the eye socket, also called orbital cavity. These muscles are controlled by the central nervous system and they help in the movement of the eyeballs. A transparent mucus layer called conjunctiva covers the inner side of the eyelid and the white position of the eye. In case of any injury or irritant, the conjunctiva produces a tear film to lubricate and protect the eye. The eyeball is comprised of 3 layers. Outer layer consists of a protective white coat called the sclera and a transparent refracting dome shaped surface called cornea. Middle layer called the uveal tract is made up of the choroid that provides nourishment to the retina, the iris that controls the regulation of light entering the eye. The central black opening of the iris is called the pupil. Behind the iris is the lens, a transparent colorless crystalline biconvex body that helps in focusing refracting light on the retina. The ciliary body that aid in focus of the light passing through the eye. A part of ciliary body called the ciliary process secretes a fluid called the aqueous humor, which fills the space between the cornea and the lens. This fluid provides nourishment to the cornea and the lens and also maintains constant pressure on the eyeball. The inner layer is called the retina, made up of specialized layer of cells which aid in image formation. Macula, located in the center of the retina and is responsible for sharp and clearest vision. The central part of macula, called fovea, contains cone cells responsible for detailing of vision and color vision. Surrounding the macula are rod cells which are responsible for vision in low light situations. At the back of the eyeball, behind the retina, lies a bundle of nerve fibers called the optic nerve. This nerve is responsible for transmitting signals from eye to the brain. The large chamber behind the lens and in front of the retina is called the vitreous cavity. filled with gel-like liquid, the vitreous humor. This cavity, along with vitreous humor, helps in maintaining the shape of the eye. Vision is a complex streamlined action. It requires the perfect coordination between light rays and interpretation of visual signals by the brain. The reflected light rays from the object in a person's path of vision fall on the eyes. These pass through the cornea, the aqueous humor, the pupil, vitreous humor, and finally on the retina. On the retina, a photochemical response is set up and the rod or the cone cells are stimulated. This impulse is passed to the optic nerve by the retinal nerve fiber. The optic nerve passes the signal to the brain where an inverted image is formed. This image is then transposed psychologically. The term visual impairment is very generic. It is a common notation that a visually impaired person is handicapped and it is very difficult for them to lead a normal life. People with visual impairment can live a normal life like a sighted person. They learn to live with their condition and it becomes a part of who they are. Visual impairment can be defined as a significant functional loss of vision that cannot be corrected with medications, surgical operations, or by corrective measures like spectacles, contact lenses. It can range from low vision through to blindness. Thus, it affects the individual's ability to learn through the usual visual sensory mode. Based on their severity, visual impairment can be broadly classified into three categories. Low vision. These individuals exhibit significant vision loss even after treatment and standard refractive measures. They may have moderate proportion of useful vision, but training is needed for them to use this efficiently. They may be able to read large prints and also may be able to learn through visual channels in addition to tactile methods. Moderate or severe visual impairment. These individuals exhibit very little unseeable vision. They can only read characters in larger prints and broader strokes. Blindness. This category of individuals exhibit complete sightlessness. They have no usable vision. They require sensory and tactile methods for learning purpose. Visual impairment is categorized based on the visual acuity score. Visual acuity is the measurement of vision clarity. It is measured at the testing distance of 20 feet or 6 meters. A person with normal vision has a visual acuity of 20 by 20 or 6 by 6 and any variation in the standard is reported as a visual impairment. The WHO categorization of visual impairment based on visual acuity is as below. Here, WHO has designed guidelines to identify total blindness. Same guidelines are followed by Indian Health Organization as well. As per them, corrected visual acuity, better eye, 6 by 6 as defined for WHO is normal and as per Indian definition also normal. Less than 6 by 9 to 6 by 18, visual impairment. Less than 6 by 18 to 6 by 60, visual impairment for WHO as per Indian definition, low vision. Less than 6 by 60 to 3 by 60, WHO definition, low vision. As per Indian definition, severe low vision. Less than 3 by 60 to 1 by 60, as per WHO definition, severe low vision. As per Indian definition, blind. 1 by 60 to perception of light, both WHO and Indian definition means blind. No perception of light as per WHO definition, blind. As per Indian definition, total blindness. Hence, based on the above information, we can summarize visual impairment as defect in seeing, irrespective of the nature or extent of disability. The functionality and performance of the activities of the individual depends on the severity or extent of disability. Hence, they need to be taught special methods for educational purposes. Visual impairment can be identified by observing the signs and symptoms in the concerned individual. These may vary from person to person based on the extent, nature, and causes of visual impairment. We will categorize the signs and symptoms into three main categories: infancy, early childhood, and school age. Signs seen during infancy: lack of eye contact, little or no blinking of eyes on exposure to bright light. Do not exhibit the observational traits like looking at one's own hands, moving objects in front of their face. Slow or no response to soundless toys. No response or imitation of facial expressions and others' actions. Find it difficult to reach out to toys within reach. Delay or inhibition to exhibit motor activities like crawling. Signs seen during early childhood. The child has a tendency to keep his/her head down and exhibit lack of eye contact. Exhibit limited or lack of facial expression and body language. Tend to hold object in close range when observing them. Look intensely at bright light. Some even exhibit sensitivity to bright light. Often bump into objects, trip over. Also, sense of direction is limited. May vigorously rub and or press the eyeballs. Abnormal movement of eyeballs. Signs during school age. May have a very short span of attention. May exhibit abnormal movement of eyes like closing one eye, blinking frequently, squinting. May dislike activities involving visual concentration. May become tired, restless, irritable after such tasks. May lose concentration while reading. May also skip words or reread the same. Exhibit poor eye to hand coordinations. May find it difficult to perform simple tasks like buttoning, unbuttoning, tying, throwing ball, etc. May have frequent eye infections like styes, inflamed running eyes, swollen eyelids. Complain of vision problems like blurring, seeing double, words or letters running. Complain of headaches, dizziness, nausea. A parent or teacher suspects visual impairment in a child. They must use the above signs as an indication of the condition. The final assessment of the impairment must be done by a qualified medical professional. Early detection is a crucial point in the case of visual impairment. Earlier the detection, easier and better is the plan of treatment and educational process. It helps in providing appropriate and timely support to maximize the child's potential. Early detection also helps in preventing the underlying emotional and behavior problems related to visual impairment. Visual impairment can be caused by several factors and can be manifested differently in each case. They may be occur at birth, congenital, or may be acquired sometime after birth. Also, in some cases, the impairment may be progressive and in some cases it can be stable. Common causes and conditions are outlined below. Infections like rubella, sexually transmitted infections during pregnancy can result in vision problems. Congenital acquired eye diseases can cause varying visual impairments. Albinism, a congenital condition in which there is little or no pigmentation in the eyes. They inherit altered genes which make less than usual amount of pigment called melanin. These individuals have very low vision and exhibit sensitive to light. Optic atrophy, a condition in which the optic nerve is affected. These individuals have reduced vision and experience difficulties with peripheral sight and color vision. High myopia. This is also called severe short-sightedness. The eyeballs are enlarged, leading to thinning of its outer coats and in turn affect the retina. These individuals have very poor distant vision and it can be degenerative. Keratoconus, a genetic or acquired condition in which the cornea becomes cone-shaped. These individuals have distorted vision and gradually visual acuity reduces. Corneal ulcers. This is caused by bacterial or fungal infection. This condition leads to corneal abrasions resulting in keratitis. These individuals exhibit extreme sensitivity to light. Photophobia. Corneal dystrophy, a genetic condition which causes the degeneration of corneal tissue. These individuals have low visual acuity, hence low vision. Glaucoma, a congenital or adult eye condition resulting in increased intraocular pressure in the aqueous humor. The damage to the eye tissue results in loss of visual acuity and low vision. Aniridia, a congenital condition in which the iris is underdeveloped. It causes reduction in visual acuity and photophobia. Iritis, an inflammation of iris caused by infection or inflammation from trauma injuries. This condition causes blurred vision and sensitivity to light. Blindness is a possible complication of iritis, but it is relatively rare. Coloboma of iris, a prenatal genetic disorder which results in a keyhole appearance to the pupil. This condition causes blurred vision and decreases visual acuity. Cataract, a congenital or senile condition which causes cloudiness in the eye lens. This condition prevents light rays from falling onto the retina, resulting in blurred vision and reduced visual acuity. Vitreous opacity, an acquired condition resulting from inflammation, trauma, injuries that cause clouding of the vitreous humor. This results in reduced visual acuity. Retinitis pigmentosa, a hereditary disorder of the retina which results in gradual, progressive vision loss. It is most commonly seen in males. Retinoblastoma genetic mutations result in the cancer of the retina. This is commonly seen in children under the age of 5. Strabismus, commonly known as a squint or crossed eyes, is an inherited condition in which the eyes do not line in the same direction, thus affecting vision. If it is not treated appropriately, this affected eye will never function well. Nystagmus, commonly known as dancing eyes, is a congenital or acquired defect due to injury or disease in which the eyes exhibit rapid involuntary movements. During birth or delivery, several factors can affect the eyesight on the newborn. A few such factors are lack of oxygen supply, retinal problems in premature babies, infection of eye during birth passage. Several factors affected vision in senile individuals, the most prominent being diabetes mellitus, followed by retinal detachment, macular degeneration. Visual impairment is presented differently in different individuals. The impact it has on the life and potential of the affected individual varies depending on many factors like age of onset, type and nature of impairment, intellectual ability, language skills, interpersonal skills, social skills, parental family support, and motivational support in educational front. Visual impairment affects various aspects of the individual's life. Infants and children may exhibit a delay in motor skills. They may not be able to reach milestones as fast as their sighted peers. Academic progress. Visual channels are the key focus in the learning, reading and writing process. This is a disadvantage for the visually impaired children as they need to use other tactile methods for learning purpose. In school age children, difficulty with spelling is a commonly seen problem associated with visual impairment. Speed of completing task. Visually impaired children usually take more time at task completion than their sighted peers. This may be a result of the limited ability to access the provided information. This shortfall should not be related to intelligence in any way. Communication. A sighted person uses language, facial expressions, reading and writing to communicate. This is a limitation in case of visual impairment. They may exhibit a habit to involuntarily repeat words or phrases spoken by others and also exhibit misuse of pronoun in their speech. Based on their educational exposure and other support system, they may have a good vocabulary but may have limited receptive skills. They may engage into conversations but the same may be superficial to the point. Environmental awareness and movement. As their vision is affected, a visually impaired person will not be able to judge distance and movement based on visual channels. they will need to use their sensory skills for this. Hence, they will need to be taught skills to move from place to place independently and safely. Social skills. Absence of vision limits the ability to recognize non-verbal clues like body language, facial expressions, hand gestures, etc. This is a drawback for the visually impaired. Hence, they find it difficult to start a conversation during social interactions. They also avoid group discussions, participating in conversations, and usually exhibit a tendency to be a passive problem solver. Interpersonal skills. They usually avoid exploration and initiation of new information. They also find it difficult to apply standard information to new situations. This is due to the inability to visualize the situation. Low self-esteem is a manifestation of this situation. A visually impaired person does learn to use his potential by various other means other than visual channels. But the above mentioned factors can have an inhibitory effect. It can delay and hinder the process of development in the individual. Hence, measures must be taken to understand these factors and their impact. Also, appropriate and timely support must be provided to minimize the impact of these factors. Effort must be made to eliminate self-limiting factors like low self-esteem, low self-awareness, inaccurate body awareness, etc. We have seen that visual impairment is manifested differently in different cases. Various external and internal factors affect the functioning and potential of the concerned individual. Some types are progressive and some are stable. Hence, the plan of treatment and learning modules will differ. Any kind of visual impairment requires immediate attention. This will be very useful in providing appropriate and timely support for improved utilization of individuals' potential, especially visual impairment in children. As the visual channels are comprised, the mode of learning and development are different from a sighted individual. The support and assistance of parents, teachers, caregivers, family, and friends is very crucial in development process. Also, while devising the treatment and development plan, we should keep in mind factors like age onset, nature, extent of impairment, etc. for better results and quality of life. Intellectual development is the focus point in the development plan of a visually impaired individual, especially children. In addition to this, focus on personal development is also necessary. Measures should be taken to work on the improvement of social skills, social interactions, communication skills, personality development, self-care skills, independence, mobility in the society, knowledge of appropriate attire, appropriate public behavior. These skills will help in improving the community life for the visually impaired. Thus, combining intellectual skills and psychological skills, we can enable the visually impaired individual to lead a better, improved life by using their potential to the maximum. Thank you.